Good morning. You're listening to WTIM, your information station, and our WTIM Pana Morning Show with Pana civic, business, and nonprofit leaders coming to you from our Taylorville studios. The WTIM Pana Morning Show, it's brought to you by our title sponsor in People's Bank and Trust, where they put people first, along with Pizza Man, Noren's Hardware, Bob Riding's Pana, the Pana and Nokomis Dairy Queen, and the Okanee Chop Shop. I'm your host, Grayson Bauman, and our guest in this segment, well, we're joined by Kevin Collins. Kevin is a nurse practitioner at the Express Care Clinic as part of Pana Hospital. Kevin, good morning to you, sir. How are you?
Good morning. I'm doing well, thanks. How are you?
Doing well on this end. And Kevin, glad to have you in here today, especially with such a pertinent topic that you're bringing forth with you. And today we want to talk a little bit about an increase in respiratory illnesses across the community, what seems to be across the country. I'm wondering if you can kind of help us make sense of everything going on right now. What's happening and what do people really need to know?
So right now we have it's flu season, so we're getting a lot of flu illnesses, body aches, chills, fevers, sudden onset, fevers around 102, 103 Fahrenheit. It hits hard and fast. We also have COVID making another comeback, and it's a different strain again, and then RSV is hitting right now as well.
So it's just a combination, amalgamation almost of those illnesses that we're used to season in, season out. But I'm just wondering, you mentioned RSV in there as well, COVID and the flu. What are the numbers that Pana Community Hospital is seeing right now in terms of those three viruses, let alone maybe some other things, mystery illnesses that might be kind of going around too? What's Pana Community Hospital experiencing?
We are experiencing a lot of flu and COVID, especially right now. Excuse me. It hasn't even peaked yet, so the numbers are expected to go up probably next week or the week after. But in the Express Care Clinic alone, we're seeing probably between 25 to 35 patients a day, and a good 60 to 70% of those are flu or COVID patients, and some of them have a combination, flu and COVID, or RSV and COVID, or RSV and flu, things like that.
My goodness. So a combination sounds obviously a little worse than just having one or the other. And so difficult to hear that that's the case for some folks out there. 25 to 35 individuals coming through the Express Care Clinic on a daily basis right now. And we haven't even met our peak is probably a concerning number there. I'm wondering when someone does develop these symptoms, whether it's flu, COVID, or RSV, or none of the above, something's going on, but symptoms are developing. How can they decide whether the walk-in clinic or the emergency room might be the right place to go? What maybe would help determine that?
So I want to clarify, it's always best to call your doctor, talk to your primary physician or provider first, because your primary provider knows you and your history. So if you are a patient who has a lot of comorbidities such as diabetes, high blood pressure, lupus, some kind of autoimmune illness, your provider might get you into his or her office right away to keep a closer eye on you. Otherwise, you could go to the walk-in clinic first. You can always start there. If you don't know, the ER does take, they can do more testing than what we can do at the Express Care Clinic, but we can test for flu, COVID, and RSV and rhinovirus at Express Care. But you can always start with us if your symptoms are, the typical symptoms, the cough, fever, runny nose, body aches and chills. But you would want to go to the ER if any of those symptoms are getting worse, such as fever getting over 103 Fahrenheit or even 104 degrees Fahrenheit, a fever that's unrelieved with medication such as Tylenol or ibuprofen, any increased shortness of breath, trouble breathing, if you're having whenever you're exercising or even walking and it causes you to lose your breath, that's when you would want to go to the emergency room.
Okay, so when the symptoms ramp up a little bit, definitely consider turning to the ER, and especially with what you laid out there, certainly would warrant probably a visit then to the ER. I'm wondering in terms of how long I've been dealing with the symptoms. A lot of folks are trying to hold out as long as they can, fight it for themselves. What might you recommend in terms of going to the walk-in clinic? Say I've been dealing with it for 3-4 days, maybe up to a week. Is there kind of a number of days, maybe a week long worth of time that you would recommend? Hey, I know you've been trying to wait things out, but but you might want to stop in at the walk-in clinic at the bare minimum. Is there amount of time or a time frame that you'd give, or would you just recommend, hey, come on in when you need us?
I don't really give a time frame, but that's a very good point. If you're having your symptoms, I like to say about a 7 to 10 day cutoff. If you're still having your symptoms and they're not getting any better, you definitely want to come into at least the walk-in clinic. But ideally, if you want to treat flu with any kind of medication that's offered, you want to get to the clinic within the first 2 days. Same with COVID, the first 2 days of symptoms, if you want any kind of medication. I mean, these are viruses, and most of them do kind of run their course in 7 to 10 days. So that's why I don't give a specific, be here on day 2 or be here on day 3 kind of rule. But I do want to clarify, if not better in 7 to 10 days, that's when we're looking at it could be turning into more of a pneumonia issue, or, something that could be that would warrant an ER visit. So, I would just say, if I had to give a window, no more than 7 to 10 days before you seek treatment.
Okay. And I was just wondering, obviously, with it being a virus, it's one of those that you want to try and allow your body to fight through. But if it's just not happening, certainly it's time to consider the walk-in clinic. Just a moment ago, Kevin, you kind of gave us an idea of some of those respiratory symptoms, maybe illnesses that would be appropriate for the walk-in clinic. Can you give us that list or a better idea again here for listeners at home or on the road today?
Yeah, the body aches and chills, is that the part you were talking about?
Yes, sir. Yes, sir.
Okay, sure. Yeah, I'll repeat those again. So if you're having sudden onset of body aches, chills, feeling tired, short of breath, headache, cough. The cough does not have to be producing phlegm. It can be just a dry hacking cough. Any fever, ideally 103 Fahrenheit or less is what we call a good fever. That's your body fighting off infection. Anything over 103 is what we call a bad fever, that you definitely want to seek treatment. Runny nose, I'm not sure if I said runny nose or not, and sore throat. Those are the typical symptoms that we consider flu-like symptoms. But again, COVID has the same symptoms. RSV has the same symptoms. So those are the symptoms that you would want to go to the walk-in and have tested.
Okay. And when it comes to thinking about the ER, that's when you really have that shortness of breath, that 103 degree plus fever, and just wanting to, again, make that distinction, as we're joined by Kevin Collins, nurse practitioner at the Express Care Clinic as part of Pana Hospital, here today talking about this boom in respiratory illnesses. In your experience so far, Kevin, I know we're going a little off topic here, but in your experiences so far as a nurse practitioner, how does this maybe season, this flu and COVID season, mixed in with RSV, how does that compare maybe to years prior that you've experienced? Where would you say we lie here in 25 into 26?
I actually feel like it's going to be a bad year this year. I've seen a lot of patients coming, like I said earlier, with more than just one. So we've had a lot of strep with flu or COVID with flu, where years past, my experience personally has not been, I've seen as much of that. They might have flu this week, COVID in 2 weeks, and then, something else later. But right now they're having more than one at one time, and they can't seem to quite get over it. And we've had a lot of patients who had a virus that we couldn't name because we don't test for it. They're getting sick, and then they're coming down with flu. And then we're seeing them again a few weeks later with, strep or something else. So I'm a little leery this season. I think it's going to be a pretty bad one.
Okay. And it sounds like it's one that's almost like a recurring illness is going to pop back up almost, where, I might have fought it for 2 weeks, but then something new when my immune system's down, it came right back for me, whether that be strep throat, as you mentioned, or something else along those lines. So I was just wondering how you might compare it to years prior in your experience. Well, we were talking, Kevin, about the fact that, sometimes a walk-in clinic visit is what's warranted, but sometimes it's an ER visit. I'm wondering why that distinction needs to be made. I have a good idea, but I'm wondering if you can tell listeners, what the purpose for the walk-in clinic is in terms of keeping that emergency room clear to the best of its ability.
Yeah. So the ER is for more critical patients. If you go to the walk-in first, you are freeing up the ER and the staff so they can take care of the more critical patients. The confusion is everyone thinks, I have a fever, I have this, I have the flu, I need to go to the emergency room, when the walk-in clinic can take care of that. And then when the ER gets overwhelmed and patients are in the hallway, or they have a 4-hour wait because critical patients do take priority, then patients are getting upset. And then workplace violence happens with, patients yelling at staff or throwing things at staff, or patients walking out because they're tired of waiting. Patients are not getting any better because they're sitting in an ER that's cramped and loud and full, and the nurses and the physicians can't give them the attention that they need.
And
So that's why I strongly encourage, when in doubt, go to the hospital, start at the walk-in clinic. We can talk to you. If we don't think it's something that we can handle at the walk-in clinic or at Express Care, we are more than happy to triage you and tell you that this is more of an emergency room visit.
And then it allows for that escalation, and then just kind of, where is the ER at right now and things like that. But helping out in that, reducing that load on the ER, especially right now during this sick season, certainly can be a benefit. And that's why we're talking with Kevin Collins. Kevin is a nurse practitioner at the Express Care Clinic as part of Pana Community Hospital, joining us here today on the WTIM Pana Morning Show. We've already knocked out 11 minutes, so we'll take ourselves our first break of the show. We'll come back and we'll talk a little bit more about this sick season and what to do and what to expect from it, as we have been told that the peak might not have even been hit. You're listening to WTIM and our Pana Morning Show. We'll be right back with more here on your information station.
Your information station. WTIM.
Spending programs. At People's Bank and Trust, we put you and your savings first. People's Bank and Trust, member FDIC, equal housing lender.
The Taylorville Tornadoes are on WTIM. Listen on air or online for all football, boys basketball, and playoff games of both teams on AM, FM, and streamed on the WTIM mobile app. Sponsored by your Taylorville McDonald's Restaurant, Advanced Title Group, CNB Bank and Trust, and Taylorville Memorial Hospital.
Purple and gold are coming your way. The Taylorville Tornadoes are going to do it today.
The Lady Tornado basketball team are on 96.5 thechill.com again this season. Listen on air or online for Lady Tornado basketball and playoff games, brought to you by the Taylorville Community Credit Union, the Christian County YMCA, Rural Rentals, and Scooters Coffee.
The purple and gold are coming your way. The Taylorville Tornadoes are going to do it today.
This is Dwayne Wheeler, the police chief of the city of Taylorville. As a law enforcement officer, I've seen the impact that depression and suicide have on many people. Many times, those contemplating suicide endure considerable suffering and distress, but there is help. If you feel depressed or lonely, there are many resources to help you. You can call a trusted relative, friend, or minister, or call the Suicide Prevention Lifeline at 1-800-273-TALK. That is 1-800-273-TALK. All of us are here to help you. Thank you.
Hi, I'm Mark Sanders, and I'm your longtime host, interviewing Shelbyville and Shelby County community and business leaders every week. For some 10 years, WTIM, your information station, has originated its Friday morning show live from our downtown Shelbyville studios. Tune in on AM or FM or online every Friday from 8:40 to 10, brought to you by these great sponsors.
Family Drug, the Villas of Hollybrook, Shelbyville Manor, and Corner Copy sponsor the WTIM Shelbyville Morning Show.
Finding a local job in Central Illinois has never been easier. Don't waste time driving far or spending too much on gas. Visit IllinoisJobPost.com. It's your one-stop site to find local, full-time, and part-time job openings. Best of all, it's completely free for job seekers to access anytime, day or night. So if you're ready to land a job close to home, make IllinoisJobPost.com your first stop. That's IllinoisJobPost.com. Brought to you by your friends at the regional radio station.
Your information station, WTIM.
And we're back on the WTIM Pana Morning Show here on your information station, and brought to you today by not only title sponsor in People's Bank and Trust, where they put people first, but Pizza Man, Noren's Hardware, Bob Ridings Pana, the Pana and Nokomis Dairy Queen, and the Oconee Chop Shop. I'm your host, Grayson Bauman. Our guest in this segment, we're joined by Kevin Collins. Kevin is a nurse practitioner at the Express Care Clinic at Pana Community Hospital. We've been talking about this sick season and the respiratory illnesses that are going around. We continue that conversation with a talk about parents, or at least more specifically geared towards those parents. Kevin, I'm wondering what respiratory symptoms in children should be those that never are ignored and would require immediate emergency care. What would you say constitutes just that?
Some of them are similar to what we talked about earlier. So with the younger the child, the more serious it can become. So again, if any child has the fever over 103 and it doesn't go away, any child that is belly breathing, what we call retractions, if they're young, like 3 and younger, more like 2 or 1 year old, children who, again, with any kind of activity, they are becoming very fatigued. Their lips are turning blue. Those are the respiratory things that you want to get to the ER.
Oof. My God, lips turning blue gave me a little guttural reaction over here. Yeah, that is certainly, I would think, constitutes an emergency room visit. And we've been talking a lot about, hey, now you've got the respiratory illness, and this is what you should do now that you're experiencing symptoms. Can you give us an idea of what might best be done to kind of prevent the spread of these illnesses, or maybe even help prevent yourself or your children from even getting them? Do you have any tips or tricks on that?
Yes. Wash your hands, wash your hands, wash your hands. Use soap and water as your friend, hand sanitizer if you need to. Wear a mask. Don't be angry if you have to wear a mask. I mean, not everyone around you is healthy, not everyone around you is sick. But if you are feeling sick and you're coughing, again, like I said, keep your distance from other people, put on a mask so that way you're not coughing on others. You can even stay home. If you're someone who is not a very healthy person and you're feeling sick, again, go to the clinic, but put on a mask, wash your hands, so that way we can keep we can assess you and let you know how you're doing. Vitamin C, we do advise vitamin C as well. Sorry.
Oh, no, you're totally fine. Yeah, that's, obviously another great point to it. I'm sure there are other vitamins or nutrients that you're probably thinking of. I would assume like vitamin D, things like that are certainly something worth noting. Zinc maybe in there as well. But for you right now, obviously you've had an important message through and through, really, which is take care of yourself and others during this illness and sick season. But what would be the most important message? What would be the one thing that you'd really like to hammer home today?
So these respiratory illnesses, they are they're serious, but they only last about 7 to 10 days. But if you again, wash your hands and keep your distance from other people. If you're not feeling well, don't go to grandma's house for, Christmas dinner or for the Super Bowl or something like that, but you got to, like you said, you have to take care of yourself. We want patients to not be lying down for days at a time. Get up, walk around inside the house, even just get your lungs open and expanding so that way you're breathing more to reduce the risk of pneumonia, because that's what's going on right now too, is patients are getting sick with more than one thing, and it just keeps multiplying and snowballing, and then they're coming in to see us, and then we have to transferring them to the ER.
Yeah, that is a piece to it that I guess, and you kind of mentioned it too, where it's like 2 for 1. You're getting like a 2 for 1 special, and then it just keeps battering you down, and to the point where, if you're experiencing something like pneumonia, my God, that could go for somebody with an even a stronger immune system. But you talked about those with weaker immune systems, or those that are maybe immunocompromised, and it's a terrifying deal in terms of pneumonia and just sickness sticking around. Well, Kevin, I'm very glad to have gotten to talk to you here today about this respiratory illness and some of the mysteries that are going around with it. And it was great to be able to kind of hammer some of that out with you here today. So thanks for joining us.
Thank you for having me. It was a pleasure.
Absolutely. Kevin Collins, nurse practitioner at the Express Care Clinic as part of Pana Community Hospital, joining us here on the WTIM Pana Morning Show. It's brought to you by title sponsor in People's Bank and Trust, Pizza Man, Noren's Hardware, Bob Ridings Pana, the Pana and Nokomis Dairy Queen, and the Oconee Chop Shop.
With SRN News, I'm Rich Thomason in Washington. 2000 and counting.